Your body hurts, you're tired all the time, and nobody seems to have answers. This is the story of millions of people living with rheumatic diseases. Today, I'll walk you through the entire patient journey so you can see the road ahead more clearly. Hello, this is Dr. Siddharth Amber from Chicago Arthritis and Regenerative Medicine. I specialize in non-surgical treatments for musculoskeletal conditions, rheumatology, and metabolic health. My goal is to help you live pain-free and healthy with treatments and strategies that actually make sense. Rheumatic diseases like rheumatoid arthritis, psoriatic arthritis, lupus, and others are long-term autoimmune conditions that affect millions of people worldwide. But what's often overlooked is the journey patients take, from the first unexplained symptoms to the difficult road to diagnosis, to the emotional challenges, and finally, learning how to manage life long-term. Understanding this journey is important for patients, family members, and even healthcare providers. Because when we understand what this path looks like, we can improve outcomes and quality of life at every step. For many patients, the story starts quietly. Subtle stiffness in the morning that lasts longer than it should, a little swelling in the fingers, fatigue that doesn't go away after sleep. At first, people explain it away. I must have overdone it at the gym, or I'm just getting older. But the symptoms don't fade. They repeat, grow, and become harder to ignore. Research shows the average delay from symptom onset to diagnosis can be months to years when it comes to rheumatic conditions. That delay matters because untreated inflammation can silently damage joints and organs. Here's an analogy. It's like driving a car with the check engine light on. At first, the car still runs fine, but the longer you drive, the more serious the damage gets under the hood. The key message is that if joint pain or stiffness is lasting more than 6 weeks, especially if it's worse in the morning or improves with movement, it deserves medical attention. Most patients don't land in a rheumatologist's office right away. They may see their primary care doctor, an orthopedic physician, even a chiropractor before anyone connects the dots. And that's frustrating because rheumatic diseases are systemic. They affect the whole body, not just one joint or muscle. The process of diagnosis involves several steps. History. What do your symptoms look like over time? Are they inflammatory or mechanical? Physical examination. Do you have swollen joints on exam, limited motion, tenderness, and other patterns of involvement all give clues? And then there's blood work. Antibodies like your rheumatoid factor or CCP antibody can be helpful, but they aren't necessarily definitive. Some people with disease will actually test negative. Then there's imaging. Ultrasound or MRI may show inflammation even when X-rays look normal. This can feel like a maze for patients. Multiple tests, different specialists, and sometimes conflicting answers. The takeaway here is that diagnosis is not a single test. It's a combination of your story, examination, labs, and imaging, all interpreted in context. One of the most important parts of the patient journey is not just getting any diagnosis, but getting the right diagnosis backed by objective findings. Why is this so important? Because rheumatic diseases often overlap with other conditions. Symptoms like pain, fatigue, or stiffness are real, but they're also common in many other health problems, from thyroid disease to fibromyalgia to even stress. If we only go by symptoms alone, misdiagnosis is far too easy. That's where objective findings come in. These are measurable, observable signs that confirm inflammation is truly present. For example, on your physical examination, do you have swollen joints that can be felt in the joints on examination and not just pain? Blood testing, do you have elevated markers of inflammation like the CRP or sedimentation rate? Or disease-specific antibodies like the CCP antibody for rheumatoid arthritis? Imaging, ultrasound or MRI, can show fluid in the joint, thickened joint lining or thickened synovium, and increased vascularity in the joint that confirms inflammation. Having these objective findings gives both the doctor and patient confidence. It removes doubt, It shows that the symptoms are not just all in your head, and it guides the next steps. Because treatments are very different for true inflammatory arthritis compared to mechanical pain or other mimics. I see many patients who were told for years that their labs are normal, so their pain was dismissed. But when we looked closer with ultrasound, we found subtle inflammation in the joints. That objective evidence changed everything. It meant we could treat correctly and stop the disease from progressing. The bottom line is that we should be striving to find objective findings, and that matters. It builds trust, it ensures accuracy, and it prevents unnecessary treatments while making sure serious diseases are not missed. One of the biggest misconceptions in rheumatology is that if your blood work is normal, you cannot have a rheumatic disease. That simply is not true. Yes, labs can be incredibly helpful. Antibodies like the rheumatoid factor or CCP antibody, inflammation markers like your SED rate or CRP can all be very helpful. But here's the reality. Up to 30 to 40% of patients with, for example, rheumatoid arthritis may have normal inflammatory markers at times. Some patients never develop antibodies, even though they clearly have active disease. Early in the disease process, labs may not show much at all in terms of blood work. So what does that mean for patients? It means that we cannot rely on labs alone. We have to step back and build a comprehensive clinical picture. For example, your history. Are your symptoms worse in the morning? Do they improve with movement? Do they last more than 6 weeks? On your physical exam, can we see and feel swelling in the joints? Is there loss of motion because of fluid in the joints? On imaging, does ultrasound or MRI may show active inflammation even when the blood tests are normal? I often tell patients labs are just one piece of the puzzle, but they're not the entire puzzle. A good rheumatologist looks at the whole canvas here. The story you tell, what we see on examination, what the imaging shows, and yes, even what the labs show as well. When all of those are considered together, we can make a confident diagnosis and start treatment when needed. This avoids both undertreatment, where inflammation goes unchecked, and overtreatment, where patients are given strong medications without evidence of active disease. The takeaway here is that normal labs do not rule out rheumatic diseases. A full, layered clinical picture is what truly leads to the right diagnosis. The months or years before diagnosis can be emotionally draining. Patients may feel dismissed, told it's just stress, aging, or all in their head. Friends and family often don't understand, but you don't look sick, is something many patients hear. This uncertainty has consequences: anxiety about the future, fear of disability, social withdrawal, because it's hard to explain invisible pain. Addressing this emotional impact is just as important as treating the joints and disease itself. Studies show that patients with strong emotional and social support cope better, adhere more to treatments, and report a higher quality of life. Once a diagnosis is made, the conversation shifts from uncertainty to action. The medical evidence is clear. Treat early and treat appropriately. For conditions like rheumatoid arthritis, damage to joints can begin within months. Starting disease-modifying therapy early can prevent irreversible disability. For example, in the past, patients with uncontrolled rheumatoid arthritis often develop severe joint deformities and disability. Today, with modern treatments, many people with RA can live well with well-controlled joints, living full and active lives with little to no disability if therapy starts early enough. An important distinction here is that mild disease may be monitored closely with milder treatment or lifestyle support only, but moderate to more severe disease requires medication. Delaying can mean losing the chance to prevent permanent damage. Once treatment begins and once your condition is under control, the journey shifts again. Now it's about learning to live with a chronic condition. Patients face a cycle of flares and remissions at times. Fatigue can become a chronic companion that can't always be explained by lab results. Planning life around unpredictable symptoms can feel exhausting as well. Daily challenges include balancing medications and side effects, adjusting work and home responsibilities, and maintaining relationships when energy may be limited. But there are strategies that can make a difference here. Exercise. Gentle, consistent movement helps to reduce inflammation and stiffness. Nutrition. An anti-inflammatory diet, rich in vegetables, lean proteins, and omega-3s can help. Sleep. Prioritizing restorative sleep reduces flares and improves energy. Stress management. Meditation, yoga, or simple breathing exercises can lower stress hormones that worsen inflammation. These lifestyle pillars do not replace medical treatment, but they complement it. They give patients tools that they can use to control their condition that often feels uncontrollable. Living with a rheumatic disease isn't just about taking what the doctor prescribes. Patients want to know, what are the risks of treatment? What are the benefits? What are the alternatives? Shared decision-making with your physician means tailoring treatment to each individual's goals. For some, the priority is staying active for work. For others, it's being able to play with grandchildren, travel, or pursue hobbies. Key point here is that patients do better when they are part of the decision-making process. It transforms care from the doctor telling the patient what to do into a true partnership. A diagnosis of rheumatoid arthritis, lupus, psoriatic arthritis, or another chronic autoimmune rheumatic condition does not define your life. With the right care, most patients can live long, full, meaningful lives. The journey is not just about controlling symptoms, it's about reclaiming identity and your joy. Examples from real life. I've cared for patients who continue to run marathons despite their arthritis. Others who travel internationally, work demanding jobs, or maintain active family lives well into their 80s. The journey doesn't end at diagnosis. It evolves into resilience, adaptation, and thriving. So here's the key takeaway. The patient journey in rheumatic diseases is complex. It begins with vague symptoms, moves through a challenging road of diagnosis, and continues into lifelong management. But it's a journey that can be navigated with the right care, support, and mindset. Early recognition and treatment changes outcomes. Objective findings anchor the diagnosis. And even if labs are normal, a comprehensive clinical picture tells the truth. Lifestyle choices add strength, and shared decision-making ensures that every patient gets a personalized approach. Above all, remember, living with an autoimmune disease is not just about surviving. It's about thriving, finding balance, and living well. If you found this helpful, please make sure to like, subscribe, and check out our website at chicagoarthritis.com or any of our social media sites for more expert advice on staying pain-free and healthy. Until we connect again, see you next time and live well.